it's my understanding that the big vein, the culprit, is usually called the saphenous vein. Is that right?
That is correct.
And I believe you can go in the saphenous vein and block it. You can go in there, do some endovascular magic, and block that vein so it stops backing up and that vein shrinks down. Is that
Yes,
correct?
that is exactly correct. You've done your homework very well, Gil.
I do a little bit. I've done a little bit of reading before I interview you.
You know way more than you're letting on. But you're exactly right. You're
So
exactly right.
how do you go in there and block that vein? I've heard of lasers and radio frequency and
Yes.
sclerosing foams and whatnot. And
Yes.
How do you do that?
Actually, you can do that with any of the modalities you just mentioned. The most common modality is using a laser to actually block off the great or the small saphenous vein in the setting of that vein not working correctly. So we have a vein, the valves are not working correctly. We have what we call reflux, which is where rather than the valves propelling the blood toward the heart, the valves are not doing their job and the blood is falling back down into the lower limb and it's pooling there, as we talked about earlier. And so in that circumstance, we want to reroute blood through veins that are functioning well. And so if we have someone that just has, let's say, an insufficient great saphenous vein, then we would go in with the laser or with radio frequency and sometimes with foam and actually block off that vein completely, which would cure the patient of the reflux they're having down that vein and reroute the blood, which the body will do automatically.
It'll find, I was going to ask you, how does it come back? It just finds another route because they're all interconnected.
Yes, it actually goes through a different pathway. And I actually might point out that that's a pretty recent development. It's a pretty recent procedure for vascular. And I would also point out that it's been deemed the second most significant improvement in vascular surgery in the last 100 years.
Saphenous vein occlusion.
Yes, saphenous vein ablation, we call it.
Ablation.
Yes. So great saphenous or small saphenous vein ablation. You can also do the same thing to accessory saphenous veins and some of the other longer, straighter, varicose branches thereof of the great saphenous vein or the small saphenous vein.
So you can really, there is hope for people, these big veins, and you can help them pretty straightforwardly.
And not only is it a very successful procedure with a 5-year success rate of in excess of 95%, but it's a walk-in, walk-out procedure.